Okay, so now I am recording my screen. We're just waiting for Maggie. All right, so this is our global health project. We studied the population health of individuals at US Immigration and Customs Enforcement detention facilities. So these are ICE detentions that have been kind of in the news recently a lot. So we were kind of interested to see more about them and kind of learn about the people who are held in those facilities.
All right, starting off with the components influencing the people who are detained. In the past 10 years, the US immigration system detained more than 30,000 people a day on average. Prior to the COVID-19 pandemic, it regularly exceeded 52,000 people daily. Historical components influencing the health of people detained by ICE include overcrowding, poor hygiene and sanitation, inadequate medical care, as well as verbal, physical, and sexual abuse. Politics are also influential in changing the conditions of the detainment center. Different presidential administrations have been influential in detaining people at the border. During the Trump administration, the amount of people being detained increased, as well as their duration in a detention facility. This administration also made policy decisions to not release at-risk populations, such as pregnant people or asylum seekers. The Biden administration has reversed some of these policies, but there's still a surge at the border. During February 2021, the first full month of Biden in office, more than 100,000 people were detained. The economies of the many countries that immigrants are coming from are also suffering. In these various countries, it's becoming more expensive to live there, and there isn't ample employment. Additionally, the COVID-19 pandemic caused Latin America's region's GDP to decrease by 6.8% during 2020, and poverty rates to increase from 30 to 33%. Public debt also increased from 68% to 77% of GDP from 2019 to 2020. Going on to the values and beliefs. Religious freedom rights in detainment facilities have been violated. Detained immigrants from a variety of religions have reported violations by Immigration and Customs Enforcement. For example, Catholics have had their Bibles and rosaries discarded by Border Patrol officials. At the Adelanto ICE Processing Center, detained immigrants have been denied access to religious texts related to their faith and in their language. Over the past decade, there has been a surge in asylum seekers from countries of El Salvador, Guatemala, and Honduras. These asylum seekers are fleeing gang recruitment, protection rackets, abuse of police, inept criminal justice systems, domestic violence, and poverty. The COVID-19 pandemic and persistent instability also pushed people from Brazil, Ecuador, Haiti, and Nicaragua to the United States. However, Mexico is still the primary country of origin for asylum seekers. Many people in Mexico believe the new administration will make crossing the border easy. This inflated expectation causes an influx of people to try to cross the border only to get sent back. When they go back to their community, they are displaced and left to sleep outside, with drug cartels making the situation even more dangerous. All these components shape the people who are being detained at the southern border.
So next we're going to discuss the global perspective of refugee and migrant health. The complex health needs of refugees and migrants is not unique to the United States detention facilities. The World Health Organization reports 1 billion migrants globally. This includes 281 million international migrants and 82.4 million people who have been forcibly displaced. Perspectives on a nation's responsibility to refugee health vary from country to country. These views can differ based on things like cultural values, government policies, and available resources. It's important to consider the variables that contribute to these differences and remember that we can collectively learn from each other's success and failures. So just to give an overview before we go into specific differences of United States, Canada, and Poland, I was specifically looking at policies and perspectives related to the COVID-19 pandemic. You can go back up to the previous slide. Sorry, Grace. But just to give an overview, globally, we were seeing high rates of infection in immigration detention systems where the rate of infection exceeded the general population. These high rates of infection can be correlated to close living quarters or prison-like environments that are seen in these systems. And globally, something that was in common was that the response and solution to this problem was releasing detainees to help limit the spread of the disease. There was some variation across countries related to the COVID policies, including the restricted issuing of detention orders, the adoption of pandemic-related measures in detention centers, and including people of concern in vaccination efforts. And you can see these on this slide. Those are the comparison of the policies. So if we go back to the previous slide again, sorry. Just some brief differences on the standards and perspectives of these different countries. So the US has the world's largest immigration detention system, and something that differs greatly from Canada and Poland is the use of private prisons to detain migrants. During the last 3 years of the Trump administration, the use of these private prisons increased significantly, including at least 24 facilities and the addition of more than 17,000 beds. The general overview of policies in Canada is that in recent years, Canada has adopted progressive refugee policies and restrictive border control measures. So they're taking in more refugees than other countries, but they have also adopted policies that restrict asylum eligibility. And again, just like these other countries, these detention centers in Canada are attracting criticism for the use of like prisons and harsh prison-like environments. And then finally for Poland, I found some interesting information on the use of healthcare in their detention centers. So there were doctors available on duty at least once per week, psychologists available at least once per week, and nurses present on a daily basis. And again, in Poland, the solution to these increased rates of infection was to ultimately release people from the detention centers.
Okay, so now I'm going to talk about the systems of power, privilege, and oppression and how that is applied to Border Patrol facilities and how they treat individuals that are detained. So workers in these facilities use their power to mistreat and abuse these detained individuals. And there are some quotes that share like personal testimonies. So here's just an example of one of those. It says, detained individuals are stripped of outer layers of clothing and forced to suffer in brutally cold temperatures. Deprived of beds, bedding, and sleep, denied adequate food, water, medicine, and medical care, and basic sanitation and hygiene. They are not given sufficient toilet paper or sanitary napkins, and they're held virtually in these facilities for days. So this shows how like the government is misusing their power in those facilities to mistreat and abuse these individuals and not treat them in a humane way. When I was doing some research, I saw that there was a difference in the way these facilities were portrayed from a government website versus the AmericanImmigrationCouncil.org. And the AmericanImmigrationCouncil.org portrays them in a factual way that shares the reality of this system, whereas the government acts like these mistreatment and abuses don't exist. And then I applied the system of privilege to this scenario by saying, like, generally the detained individuals were from Mexican nationalities. And so you can see that. Grace, will you go to the next slide? And this graph right here, it shows, or actually, Grace, go back. I'll actually get to that graph in a minute, but if you look at these percentages here, it shows you Mexican nationalities are 57.1% of the individuals detained. And then it's usually Guatemalans, Salvadorans, and then Hondurans. And these countries are significantly poorer and they have a lot more crime and homicide. And all these people are generally fleeing these situations for safety. And US is using our privilege of safety to, or our own privilege that we have higher socioeconomic status than these individuals, and we're mistreating them, which shows that it's a system of privilege. Okay, you can go to the next one. And then this graph just shows how long individuals usually stay in these Border Patrol facilities. They're not supposed to stay in there for more than 12 hours, according to the Border Patrol memorandum in 2008, but this usually is never the case. So you can see how like 38% of individuals detained are in there for at least 24 hours or less than 48 hours, but still they're not given the adequate treatment to be in there that long. Okay, you can go to the next slide, Grace. Thanks. And then I compared our system to the system of Greece and how they treat their refugees and asylum seekers. And they've hosted over 186,000 refugees and then 5,000 unaccompanied minors. And they have a system that's built on like morals and empathy, because they try to transition these individuals into their society, since there is so like a language barrier. Usually there's social barriers, there's a lot of trauma in some cases. So Greece works on trying to help these individuals into their society and be able to function through different interventions and programs and accommodations, compared to the US, where we have our system more built on imprisonment and hostility towards these individuals, instead of trying to like support and help them transition into a safer life.
All right, so then we researched the primary, secondary, and tertiary public health interventions that take place in these detention centers. So primary interventions are usually vaccinations and education. And so I did find that some of the family detention centers or the residential family centers located in Texas and Pennsylvania have classes for families, and it's specifically parenting and nutrition classes. And then in terms of vaccinations, so ICE is kind of lacking an overarching vaccination schedule or prioritization for vaccinations. And so the current standard is that each detention center is responsible for developing their own plan for vaccination as well as education. And they are obligated to follow local, state, and federal guidelines, but there's no set requirement from ICE or the Department of Homeland Security. And then for secondary interventions, which is primarily screening, ICE reports that within 12 hours of detaining an individual, they give them a health screening. And so that screening includes testing for infectious diseases, including COVID-19, tuberculosis, and a pregnancy screening. And they also go over kind of a health history and medication list. And basically they're kind of assessing for any urgent medical needs. And so that leads us to kind of their tertiary interventions or their treatment. So if anybody has urgent medical needs, they're kind of kind of pushed to one of these provider assessments quicker. But the kind of standard is to have an assessment within 2 weeks for adults or 48 hours for minors. And the assessment includes mental health assessment, following up on chronic conditions that a patient might have or any that are discovered, as well as dental treatment and treatment of conditions identified. So if they had a positive tuberculosis test, they would start treatment for that. And kind of one thing that I noted from this is that they could definitely, I think, have more primary education interventions as well as their immunization interventions. So education about mental health or chronic conditions, I think would be really effective to kind of start the ball or start the process for some people, and kind of help catch some of those things earlier, or kind of teach people to what to watch for in their relatives or themselves to prevent these things. So that's what we found from them.
All right, so then I'm going to address the role of the community nurse. So in regards to the wheel of public health nursing, nurses use a variety of care that is individually focused, community-based, and systemically driven. They use case findings to determine what is best for the population. Public health nursing requires a combination of collaboration, health teaching, screening, outreach, surveillance, disease and health intervention, advocacy, and policy enforcement to care for this population. One of the main roles is to advocate for the community. The conditions in these facilities is very poor due to the confined spaces. The individuals are mistreated physically, emotionally, mentally, sexually, and medically. It is essential for the nurses to promote infection prevention, improve the environmental health, evaluate the nutrition per individual rather than based on the groups, based on their religious, cultural and physical differences, and they must provide immunizations. An issue that public health nurses are battling is managing outbreaks due to disease. They must respond directly and immediately to the outbreaks and provide surveillance. In a case done between 2017 and 2020, among 22 ICE detention centers, there were cases of 1,280 influenza outbreaks, 1,052 varicella outbreaks, and 301 mumps cases were identified. So nurses are currently fighting for routine vaccination on entry into the centers because right now it's not currently conducted and it's only used in certain instances with children. To fix this, it would require a policy change. Policy change would expand routine vaccination on entry for children and adults and promote infection prevention practices. The nurses are also working to provide education to the individuals in the center to ensure that they are aware of the care that they are receiving, because medical literacy is oftentimes low in the facilities. They are also advocating for ethical care to patients by providing patient privacy and confidentiality. It has been reported that custodial officers have been entering into the room with the individuals when they go to the hospitals or receive care. So this has been shown to discourage patient-provider relationships and promote unethical care and negatively influence the outcomes that these patients are receiving. Nurses have been fighting to refuse the custodial workers access into the room to promote the health of the clients. Next. All right, and so then linking this back to our course material, the detainment of individuals at the ICE detention facilities and the role of public health nurses aligns with the concepts of the course in many ways. Population-based practices are utilized within these populations because ICE centers are secluded communities, and the health of this population is vastly different than the majority of the United States as a whole. Health promotion and disease preventions are practiced through following the wheel of public health. Assessments, screenings, and surveillance methods are practiced. Environmental and community safety are concerned due to the poor hygienic conditions of the confined spaces in the detention centers. And then Lastly, immunity and infection control are addressed by managing outbreaks within the centers and fighting for policy changes that would enforce vaccinations within these facilities. And so then that is the rest of our project, and these are our sources.
Thank you for watching.
Let us know if you have questions.